Hello. So today I'm so excited to have Dr. Miranda Naylor, who is a board certified functional medicine doctor who does women's hormones and fertility, join us today on the topic of estrogen dominance. So thank you so much for being here, Dr. Naylor.
My pleasure.
Awesome. So the reason why we're talking about estrogen dominance is because it comes up all the time when we start to talk about hormones like estrogen, progesterone, and testosterone. And it also shows up in symptoms, especially around perimenopause. And so before we start, I would love for Dr. Naylor for you to introduce yourself to everyone so they can get to know you.
Yeah. I'm Dr. Miranda Naylor. I'm a board certified family medicine doctor turned functional medicine doctor, specializing, like you said, in women's hormones and fertility. I'm in California, in Encinitas, California. And I'm just really passionate about supporting women's health in general. I feel like it's such an underserved population to really be addressed appropriately in medicine. So I love it.
1,000%. And yes, women definitely need that support. So thank you for doing that. What is estrogen dominance and what causes it?
Yeah. Estrogen dominance is a very hot topic nowadays. And basically what we mean when we're talking about estrogen dominance is that estrogen might be getting a little bit high compared to our other female hormone, progesterone. Now, this is always the case, right? So our estrogen is actually always a lot higher than our progesterone. So it's really a misnomer to call it estrogen dominance because there's never a non-estrogen dominance. But with that said, we can have a disproportion of, estrogen being magnitudes higher, much higher than it normally should be, or our body is perceiving our estrogen as being higher and our progesterone is maybe low. So we're talking about estrogen, focusing on that and calling it the bad guy. In reality, sometimes it's just that progesterone is really low and that it's struggling. And so we don't have the balance that we want.
Excellent. So thank you so much for clearing that up. And then why is this such a misleading term that we see a lot of patients coming in with saying, oh, I have estrogen dominance and being super concerned. But like you said, with estrogen being higher, but why is that misleading for patients?
Yeah, well, I think things are oversimplified a lot of times, especially on social media and things. When people are getting clickbait, they're oversimplifying what it really is. And like I said, estrogen is always higher, and estrogen has a lot of really good effects that come from it. But there can also be some not so great effects if we have estrogen that is what we call unopposed. If we have estrogen without progesterone, that can be a problem. Say if we're not ovulating at all, we're not having any progesterone going. That can be sort of an imbalanced place to be, or we can start to have issues that come up from that. But again, it's not everything is always related to the progesterone. I think it's important. I can actually have 3 different reasons for estrogen or that estrogen dominance that I like to talk to my patients about. One could be that our estrogen is high. There are different reasons why estrogen could be high, including perimenopause. Or we could have progesterone being low. Like I was mentioning before, that imbalance could come from just not having progesterone and not enough progesterone. And the third thing could be our body perceiving our estrogen being high, even if it isn't. And that can go along with things like xenoestrogens, which are toxins that bind to estrogen sites and make our body think that our estrogens are maybe higher than they actually are and can cause symptoms.
Excellent. Thank you so much for clarifying that as well. Just so the listener knows, what are the optimal ranges for estrogen or progesterone? Where should those even be at in the first place?
Yeah, that's a great question. Very hard to answer because in reality, our hormones are fluctuating very widely throughout our cycle, particularly estrogen. The place that I like to test estrogen to start with is typically day 3 to 5 of our cycle, so that we're getting a smaller window of where we would expect it to be. Again, there's still a range here because sometimes we could have higher estrogens later in our cycle and it could look normal then. So it isn't the whole picture, but usually I like to see that maybe around 25 to 50 or so, again, depending a little bit on the situation. In other places in our cycle, there's a different range. And another example there that sometimes we're checking it would be a mid-luteal phase test, which would be basically halfway through between ovulation and our period. And that depends the actual day. Sometimes we'll call it day 21, but it really depends on when you ovulate, how long your cycle is. But when we check it there, it could be up to 150 or so and still not necessarily be a problem. Sometimes we want to see it a little bit lower. Again, I like to look at the whole picture and really talk to women about their symptoms because that can tell us so much more sometimes than the actual testing. For progesterone, this only happens after ovulation. So we'll only check it then. And that we expect in the mid-luteal time period again to be ideally about 10 or so. Above 4 confirms ovulation. So that's sort of the minimum. But for optimal fertility, optimal health, we like to see it about 10.
Okay, perfect. And that's on day 21.
Again, yeah, that day, big air quotes, day 21.
Yeah.
Really, or the way I describe it more quickly is like 7 to 10 days after ovulation. So ideally someone knows when they're ovulating and then they can time it that way.
Love it. Oh, so helpful. So what is the best way to really approach the term of estrogen dominance? Like, how should we really be approaching this instead?
Yeah, I mean, again, I think it's having that healthy perspective of what it actually means, really knowing the symptoms to watch out for, how to listen to our body and to read into the signs that it's giving us, and then being able to act from an empowered place and do something about it. I think that's the best way to look at it and approach it.
Super helpful. So I know you talked a bit about lab tests, but are there any tests that someone should consider for estrogen dominance? Like, how would they know?
Yeah. So again, I think the good starting point is to look at symptoms, look at the cycle, work with a doctor if you're not sure what to look for, what's going on with this. Testing can be a great starting place too. Again, like I was saying, it doesn't give us the whole picture, but it gives us a lot of great information. I also like to do comprehensive blood work, not just the hormones, so that we're seeing all of it. We're seeing if we're having signs, say, even if vitamin D is low or iron is low, things that could impact our cells working optimally, that can impact all of it. I also like doing deeper, more functional testing, and that can be really helpful too to see our detox pathways backed up. That could be a big factor with our estrogens being higher, because when we make estrogen, we also have to get rid of estrogen. And so that's sometimes the factor with it running high. So looking at the big picture and really seeing how your health is overall can really give you a lot of insight into what to do to improve it.
Yeah, so many other things to look at besides just estrogen and progesterone. What are the symptoms of estrogen dominance that someone should look out for?
Yeah. Some of the most common symptoms of estrogen dominance would be things like sore breasts, having heavy periods. Sometimes it can show up like water retention or bloating. Again, it depends a little bit on what progesterone is doing too. We can have really bad periods. Heavy painful periods. Also bad PMS. So before a period, if you're feeling extra moody, extra irritable, that can definitely be a sign that there's that imbalance going on.
Thank you so much for that. That's super helpful. And also, it helps people be aware of the things to look out for, because often they may not know. And then for estrogen dominance, like, what else could these symptoms be, or what does this similarly look like?
That's a great question. A lot of the time things all mash together. Say, for an example, a woman going through perimenopause, she's like, I am suspicious that I have hormone things going on because I have bad PMS. My periods are heavy and painful like they never have been before. But she could also be having things like brain fog and other symptoms. And it can be kind of this big mishmash that's happening with, maybe estrogen is going higher. Maybe they're not ovulating anymore. Their cycles could be irregular, and all things can be happening all at the same time. So there can be other causes for all the symptoms. And that's where, again, it's good to look at the whole picture and make sure that nothing else is going on. Talk about what exposures are you having to different types of chemicals? How are you eating? Is your blood sugar going crazy and, going up and down all throughout the day? If you're sleeping well or not, which could also be a sign of being off of the hormones. So again, really looking at the full picture to being able to tease things apart.
Perfect. Yeah. Again, so many other things to look at. So that is very helpful. And then what are other conditions that estrogen dominance impacts? I know you mentioned perimenopause and fertility. So what are these other conditions that it impacts?
Yeah, I like to take a step back to talk about what estrogen does, to think about what things could come from it. So basically, estrogen is our growth-promoting hormone that gives us our boobs and our hips, gives us our period. It's promoting of the growth of our, female characteristics. And progesterone is the opposite of that. There's sort of a yin-yang. Progesterone calms things down, stabilizes the uterine lining. So that kind of helps us think of, well, if estrogen is being uncontrolled, if estrogen is really high, maybe we don't have any progesterone on board, then we can have too much growth. So it could look like, again, breast tenderness, but maybe breast cancer or breast like fibroids and things like that, more nodules happening. We can have abnormal growth in our uterine lining, like fibroids, polyps. We can have ovarian issues as well. All those things, if we're thinking about too much growth, a lot of that can happen. And so those are definitely, looking at estrogen is a really important area when we're seeing an end result like that.
Yeah, and I know you mentioned in that about xenoestrogen, and daily toxins. So what would somebody be looking out for these xenoestrogens?
Yes. So they're all around us, which can feel terrifying, but also it can be in everyday items. So cleaning products, it can be in a lot of our beauty products. The ones to sort of look out for, like the names that we might see on a label would be something like parabens or phthalates. Phthalates often goes hand in hand with fragrances. So sometimes it says perfume or fragrance. That can be a sign that there's phthalates in there. They want to watch out for those. There are also things like heavy metals can act like endocrine disruptors, particularly mercury. So eating a lot of fish, big ocean fish that has accumulated a lot of mercury, that can be a factor. So again, we tend to have a lot of little exposures. And so looking at all of those places and limiting those can be really helpful. And starting to get rid of fragrance is a good starting place. Tends to be the simplest place to start too. Like, okay, let's just wipe out all the fragrance. Let's get the plugins out of here, scented candles, scented laundry detergent, and really start to switch those out. And usually it's a process of learning, oh, wait, wow, this is in this one product. I didn't even think about that. Okay, and switching that out. Yeah.
Have you seen it also in lotions? I know because even when you're applying progesterone cream or testosterone cream, or not progesterone cream, testosterone cream, that's a lotion. So how much are you really absorbing in these lotions? So have you seen it in lotions as well?
Yes. Yeah, it's very common to have parabens in lotions because it is there for the texture of it, basically. So it is possible to get paraben-free ones, and that can be a good thing to look for in the label. Oftentimes it'll say paraben-free, but a lot of things, like ointments, creams, most of them have parabens in them, even dermatology recommended products too. So that's a good one to look out for. And luckily it's an easier one to see. Sometimes the labels can be very confusing with all these different chemical names, and we don't know if it's really concerning or not. Usually parabens have some sort of paraben in them, like methylparaben. You can also check products on the Environmental Working Group website, ewg.org. And that can be a good source too when you're curious about, I'm taking a prescription cream. Does that have something bad in it, for example? You can look those things up to see how concerning those chemicals are.
That's super helpful. Just so people can kind of be on the lookout for those things and also looking for other alternatives. Is there anything else you want to add to this conversation on estrogen dominance that you feel that is really important for people to know?
Yeah, I was kind of mentioning we villainize estrogen. It's like estrogen is not the enemy. I like to remind people of that. We will miss estrogen when it's gone. In menopause, we then have a whole host of other issues that can come up from not having estrogen. So it's not that estrogen is the problem. We just want to keep it in check, make sure that our body is working, the way that it should. It's able to produce its hormones appropriately, and it's able to get rid of its hormones appropriately. So I know you specialize in gut health as well. Gut health is so important for everything, but it also includes getting rid of our estrogen metabolites, which our estrogen metabolites can actually be more dangerous than our estrogen. Supporting our liver function, supporting our gut health can be really important for keeping that estrogen balance too.
1,000%. Yes. Yeah, because we don't want to get rid of all the estrogen. As you said, we need it also for our skin. There's so many good estrogen creams that it keeps our skin beautiful and taut.
And that's perfect. Balance, just like anything else in life, right? We want balance, not to completely avoid it. Yeah.
Such a good point. And then where can people find you?
Yeah. So on social media, I'm on Instagram, Facebook at drmirandanailer.com, or I'm sorry, at Dr. Miranda Naylor. My website is drmirandanailer.com. So you can also find me there.
Perfect. Thank you again so much for sharing this incredible knowledge with our listeners and for bringing such incredible insight to this conversation. Because again, it's sometimes very, very misleading. So we're so glad you came to bring all the clarity. So thank you so much for joining me.
Absolutely. My pleasure.
Perfect. Talk to you soon.